Well, knowing or receiving first aid in many instances can be the difference between life and death, but what about when it comes to our mental health? Is there such a thing as mental first aid? Well, joining me now to talk about just that are two people who will definitely answer yes to that question, as they're both mental health first aid senior training specialists with Optum Idaho, Kelly Knowles and Tracy Carlson. Thank you both so much for being here today.
Thank you.
All right, so very important issue we are discussing this morning. So Tracy, let me start with you with, of course, the most important question. What is mental health first aid?
Yeah, so mental health first aid is just like people take a CPR class to help somebody in having a medical issue. Mental health first aid is that for a person going through a mental health challenge or a substance use challenge. And the training gives a person the tools and skills necessary to basically understand, respond, and help that person get through that moment, that crisis.
Gotcha. Okay. Now, you use the word challenge. I haven't heard that too much. That sounds, like I said, not something I've heard too much. So let me ask you, Kelly, what are some of the key signs of a mental health or substance use challenge?
You're looking for changes in that person. And, you know, are they more tired? Are they not attending functions like they used to? Are they disheveled? Are they being more angry, or have they stopped eating? And not that things like that aren't common with anybody during any time, but what you're looking for here is the consistency of that. Is it getting worse? Are you noticing a change in someone who was normally very active and participatory? All of a sudden they're withdrawing from you.
Gotcha. And would you say, either one of you, this is something that happens pretty quickly and maybe relatively dramatic in any way, or something that happens over time, or how does that?
It could be both.
It can, yeah, it definitely can be both.
Yeah.
Yes.
Another sign too is somebody giving away their pets. That's a sign.
Right.
That, you know, people need to be paying attention to some of those signs, and so that's the mental health program really does teach you some of those things to look out for and some of those tools to really understand if a person's going through that challenge.
Okay, important there. And what are some of the skills that are needed to help somebody through that challenge?
We are taught through mental health first aid. There's an acronym called ALGE. Okay. And ALGE means you assess. So you're assessing the situation. L is to listen. So I'm listening to that person to find out what's going on and asking questions. And then I'm giving. So I'm giving back my time, my reassurances. And then I encourage them to seek professional help. And then I encourage them also to seek self-help, because we can help ourselves too either way.
Okay, gotcha. Is there anything you want to add to that?
I would just say that model is, it's not a linear model. So at any time we're assessing the situation, we might be jumping into the G, giving that reassurance and information. Or maybe it's encouraging, you know, that self-help piece that a person doesn't recognize that they need. But it's definitely a model that we spend a lot of time on in the mental health first aid training.
Okay, gotcha. Now let me ask you there, Tracy, what are some, what do you say are some of the key skills learned from this mental health first aid training?
Yeah, so there are a lot of skills, but the one piece that I really took away from it was the ability to assess for the risk assessment of suicide, and having the knowledge and the, I want to say, permission to ask the questions that help you assess if this person is contemplating suicide. And so that very first question, are you thinking about killing yourself? A lot of people shy away from that question. It feels uncomfortable. And so mental health first aid gives you those skills and knowledge, which is powerful in preventing suicide. And so we really take some time in that space to practice asking those questions, so that when the time does come, real life scenario, the person taking the class is prepared to ask those questions, and each question takes you down the assessment model to figure out where the next steps are. Is it that we call 911? Or is it that we just are supporting that person and getting that professional help? And mental health first aiders, we never do this alone. We always get them to the professionals. So we're just that initial first help that happens when somebody's going through a mental health challenge or substance use crisis.
Okay, gotcha.
Yeah. And it's also about giving hope
Yeah.
because there is that loss, that sense of loss of hope. And so that's also one of the things we're taught, is to give that hope and reassurance.
Yeah, just having that someone there to listen to in so many cases just makes the biggest difference.
It does.
Now, if we think about something like a CPR class, we know there's a million places to sign up and things related to that. But what about mental health first aid classes? Where can you do that?
You can go to the OptumIdaho.com website, and if you scroll down, there will be a link to take you to the mental health first aid sign up. And so you'll sign up electronically that you want a class. And then keep in mind, all the classes are free. We are supporting that so that we can train as many people as we can throughout Idaho on what signs and symptoms to be looking for.
Gotcha.
And Optum Idaho pays for that training, so it's
Correct.
free to
Yes.
any Idaho resident. So
Wonderful.
that's
It-
wonderful.
It sounds to me like this class is something that, I feel now more than ever is just as important as learning something like CPR.
It is.
It really is, because Idaho has Idaho's suicide rate is 1.4 times the national average, and it's the ninth leading cause of death. And so, yes, it's important because, again, knowledge is powerful in preventing suicide. That early prevention.
Gotcha.
Yeah.
Now, I feel like the answer to this next question is everyone, but who would you say, Tracy, could benefit truly from this learning?
Yeah, everyone for sure. But with we have adult mental health first aid. So it's basically peer-to-peer understanding, maybe colleagues in your workplace, adults around you. We also have youth mental health. So that's important for adults working with youth, 6 to 18 years old. So teachers, coaches, youth leaders, all of those people that interact with adolescents to basically understand some of these signs and symptoms. So, yes, everyone. We have different resources for like first responders, veterans. So there's just a plethora of people that could use this training for sure.
Great. Kelly, let me ask you, once you do get certified, you take the class, what happens after that?
You should have the knowledge and the information you need to assess people in situations. Just like you would in a CPR class, you may not have to use it immediately after you finish class, but to have that knowledge and understanding so that you can assess any situation that you might encounter. And so that's really what you do. Knowledge, like Tracy was saying, knowledge is powerful, and if you understand that and you're in a situation and you're thinking, that person doesn't seem right, just ask them, are you okay? And I know since I've had the training, I ask more people than I used to. And it just making sure. And it's not just saying, how are you? And just, how people can do that. But it's really giving that eye contact and really making sure they know that you want to know if they're okay. You seem a little quieter today. What's going on? And just ask those questions.
Yeah, there's a huge difference between saying, how's it going, but then actually caring how
and
it's
stopping,
going.
and waiting for the answer
Right.
and the response, yes.
Wonderful.
I would also say too, having that certification allows you the space to increase mental health literacy and support reducing the stigma that's associated with mental health or mental illness. And then also just, like Kelly's saying, now you have the skills and you know how to open up that dialogue and take it just that one step further to help somebody.
Yeah, and I think, personally, as a male, I think this is something that, of course, everybody should benefit from, but males take this class because learn how to express your feelings.
Correct.
And ask other males how they're feeling, because
Right.
as we know, so many males hide their feelings, and
They do.
You don't want to wait till it's too late.
Absolutely.
All right, well, last question I have for you, really, where, once again, you already mentioned the website, but where can people go for more information or potentially to sign up for one of these very important classes?
The OptumIdaho.com website. It will take, when you click on the link to that, it'll actually take you to a form.
Okay.
And that form tells us your interest, whether you're interested in youth mental health first aid or adult mental health first aid. And then those resources go out to instructors throughout the state. We have actually 60 instructors throughout Idaho who teach the adult mental health first aid. So it's nice because we can hit not only we can hit those rural communities as well as the populated communities.
Yeah, and that's incredibly important, especially knowing how different it is in rural areas.
It's
to get
very
that mental
different.
health.
Yeah, it's that closed.
Yeah, and also we do classes in person and virtually.
Oh,
Yes.
great.
So that's an option to hit those rural communities as well.
exactly.
And then also people can they can go on the National Council for Mental Wellbeing website, which is who trained us, and get information on there. They've got a lot of resources and information on that website as well.
Yes.
Perfect,
Yeah.
perfect. Yeah, and I think just along with this, with what you're saying, is just no matter what, if you're feeling like something is off, there is help out there.
There is.
There
yeah.
is.
Yeah.
All right, ladies, is there anything else you wanted to add about mental health first aid or anything else today?
Please sign up.
Yeah.
Because the more people we educate, we're trying to reduce that, the suicide rate in Idaho.
Yeah.
And if we can get more people educated and knowledgeable and what to look for, then hopefully we can reduce that.
Yeah.
Yeah.
Well, hopefully this is a type of class that we can make just as common as getting your CPR
Correct.
certification.
Yeah.
Right.
And I think that's the goal.
Except
Yes.
this one's free.
Yes.
Even better.
Even
Wonderful.
better. Yeah.
All right, well, joining me this morning has been Kelly Knowles as well as Tracy Carlson, both mental health first aid instructors with Optum Idaho. Thank you both so much for being here today and
Thank
wonderful
you.
information.
Thanks.